Hi, my name is Aaron Brooks, and today I'd like to talk about shoulder pain. Today we actually had a client come in that had some shoulder issues, and he had come in and was basically diagnosed as having a rotator cuff issue. There was some impingement, some inflammation, and so going over the health history form, I was asking him, okay, well, what have you done in the past to address this problem? And the most recent thing he had was he'd gone through some therapy, and he actually brought in the exercises that they prescribed to him. And although I thought they were good exercises, they really weren't getting at what the root cause was. And these are some of the things that many of you could probably relate to, and that was the standard rotator cuff strengthening exercise, which is doing the bands this way or the weights and the lifting this way and the pull downs. And again, they definitely have their place, but when we did the evaluation on him, we noticed that the right shoulder was significantly lower than his left side. So right off the bat, I'm thinking to myself, okay, well, how is doing specific rotator cuff strengthening exercises going to actually help this person if there's such a discrepancy? So, for instance, if this right shoulder was lower than the left, it's impossible for the muscles on that right side to be on the same length tension as the ones on the other side. So essentially, sometimes when we're given these rehabilitative exercises, you're actually strengthening some of the dysfunction that's already pre-existing. So the other thing we noted with this gentleman was the position of the shoulder blade. The shoulder blade was actually pulled away from his spine compared to the left side. So looking at those factors, we developed a series of corrective exercises to actually balance out the heights in the shoulder and to get the scapula even with the left side. So if you look at yourself in the mirror, if you're suffering from shoulder pain, and you see an asymmetry with the heights of the shoulders, that should be a red flag. You should automatically think, well, I'm out of balance, and that needs to be addressed first.